I want to address this because this is so important. Most especially, this is also part of the reason a lot of students fail the NCLEX exam. Now, you have your NCLEX question like this. Pay attention to me. Right? You have your NCLEX question like this. Now, you read the first part of the question and then automatically, right, you are thinking of a certain answer. That is what a lot of students do. When you read your question, you end up what? You've thought about a certain answer you should see among the list of what? Answer keys. Now, this is the problem. I've seen this many times. Most people that fail the NCLEX exam come to me. I want you to help me, this and that. And, I try to find out what is the problem. Some student will say, oh, I did a particular program. They said this about this particular content, but I saw that content on the NCLEX exam, but the answers they were telling me to watch out for, I did not see that kind of answer in my answer keys provided to me on my NCLEX exam, right? And not only that, I do post question on my Instagram page. So I also used to notice most people on the comment section will say, oh, I thought we always used to do this first, but I'm not seeing that as part of the answer. Okay, great. Now let me give you one scenario. Like now, let us say this is a question, right? This is a question, right? And I ask you which of the following number come first, and I put let me do it like this. I ask you a particular question and I say, which of the following number come first? And I say 3, 8, 2, 5. Right. Now, and I ask you which of the following number come first. Now, the people that think the way I'm trying to explain is that now the fact that they read in a particular question that the question is talking about numbers. Now, in their mindset, they don't care about the answer key. They care about the fact that the question is saying which of the following number come first, and they believe that 1 is first before 2, 3, 4, 5, 6, 7, 8. So now this is what they think. So now when they look at the answer provided and they are not saying 1, then it becomes a problem to them. I don't understand why, but this is what I'm just trying to explain. Now, they will not start saying, oh, 1 is the number that what? Come first. Now, so they are looking for 1 in their answer key, and this is a wrong way to answer question, because answering NCLEX question is not about fitting your desired answer to the question, but is about answering the question based on the available answer. Now, let me now tell you a real life situation. A particular student answered question on the NCLEX exam about what? Blood transfusion. Right. Thank God she remembered the question so well. So she was able to describe the question to me. Now, do you know what she said? She said, oh, Rima nursing book did not contain all those related answers that she saw. So she was not able to know whether she selected the correct answer related to that blood transfusion or not. Now, I said, okay, list the answer keys you saw. She was able to list them perfectly, right? She was not even struggling to remember them. Then I said, okay, this is your answer to that question, right? So now she said, why? And I was like, okay, now you're asking why the answer is the answer. Because you are used to what? Quick, fat. You are used to what? Quick, fat. If you are used to quick, fat kind of answer without knowing the reason why, let me tell you, before you can think about any answer on the NCLEX exam, right? It's not about knowing the reason for that answer. It's just like now, if a patient, like IV fluid is used for a lot of things, right? IV fluid can be used for a patient who have low blood pressure. But guess what? Now, guess what? This IV fluid that is very good for low blood pressure can be a particular intervention that can be very bad for another patient what? condition. So because IV fluid is a particular answer on a certain question, don't mean IV fluid will be a particular answer on all questions when you see IV fluid. You need to understand why IV fluid was the answer for that particular question. Because today, exercise might be good for a certain patient based on how NCLEX is going to write it, and exercise might not be good. Now, in general, exercise is good, right? There's no contraindication to exercise, right? But the only problem is the way NCLEX will describe the kind of exercise. Because exercise is so good to the extent that if you cannot do it actively, maybe you do it passively, right? Now, exercise is so good, but NCLEX don't want vigorous exercise or severe or stressful exercise. And also, NCLEX don't want you to perform exercise many times in a day. Instead, they want you to maintain what? 30 minutes, 5 days, which equal what? 150 minutes in a week. Right. So this is a positive exercise on the NCLEX exam. Now, NCLEX can write exercise and start including vigorous, severe, stressful, or many times in a day in related to that exercise. Then you know that in that particular sense, those form of exercise are wrong. Does not change the fact that exercise is good. Are you understanding me? Now, let me explain another thing to you, so that you know how the NCLEX work. I'm just trying to give you eye opener in this particular video. Now, there's a particular question that had exercise, right? Exercise in that particular question, right? They did not say anything about the exercise. They did not describe how long how much you should be performing the exercise. They did not put any kind of red flag statement to tell us that exercise is bad. Now, pay attention to me. Exercise, you might be saying, oh, exercise is good, so possibly that would be the answer. But you need to ask yourself, that's what I'm saying, you need to ask yourself, why we exercise? Now, the NCLEX did not say any bad thing to make us say this exercise is wrong related to the answer. Now, but before you will select exercise as the answer, you need to refer back to the question and find out if the question is asking what? Exercise related answer. Because this is a good option does not mean it's going to be correct to that question. You need to find out if it is positive to the question. That is what we mean reason. So, if you learn quick facts, you will miss valuable clue. You will only find out that you are learning answers, right? But you are not learning why, and you are not learning more than the answers you know. But the moment you start learning answers and learning why, you will be open to more possible answer, even when you only had maybe 4 answers in mind initially. That is the main reason why when a lot of students want to answer question on the NCLEX exam, because they learn like shortcuts in a shortcut format, when they go on the NCLEX exam, they expect a certain answers. I'm telling you, I've seen this over the years, right? I've been coaching for the past 2 years, and this is what happen all the time, right? Students will be answering question and they say, but I thought someone, I've seen this. There's a particular student who was telling me, I swear my lecturer told me this will be the answer. But the answer that she was saying is nowhere found in the answer key. He said, but my lecturer said this is the first thing we always used to do. Yes, your lecturer is right if they say that's the first thing you need to do. But the fact that that answer is not available here make it not an option. So focus on what has been given and then answer the question. You understand? Now, the problem is some people, students don't understand what you mean by first, what you mean by priority, what you mean by most important, what you mean by best. Because your lecturer said the first thing you need to do for a patient that is having shortness of breath is to elevate the head of the bed, does not mean NCLEX will provide you elevation of the head of the bed. So NCLEX might just tell you give bronchodilator, NCLEX might tell you give oxygen, NCLEX might tell you other options, and you are not going to see elevate the head of the bed. Are you now going to now fix option 5 as head of the bed for the NCLEX? No, you need to pay attention to what the question is saying. So what you are bringing to the question don't matter, is what the NCLEX is giving to you. So stop that attitude of like, why is it that the NCLEX did not have this also answer, and focus on what is there. So the reason why you keep asking Why is it that the NCLEX don't have a particular answer? It's because you are studying quick fact. You want to understand more of the content, and this happen majorly with students that use just question bank just to know the rationale to right and wrong answer. That is it. So those people don't have more knowledge of related answer. So those people now, their own goal is that the question bank favor them in order to answer question. Now, so if the question bank is not giving them related question on the NCLEX exam, so they end up what? Failing the NCLEX exam. That is just it. So fix this. Right. When you're answering NCLEX questions, stop bringing your answers that you are thinking of to the question. Focus on the answers that are available on your NCLEX exam and answer it related to that. Right. I wish you all the best.